Welcome to the Regulatory and Facility Compliance Training for DSP staff at Vagpals Residential Care Center, Inc. Incident reporting requires immediate action for falls, injuries, behavior incidents, medication errors, abuse allegations, and elopements. Remember to complete the Special Incident Report, or SIR, before your shift ends. Any fall with injury or requiring medical attention must be reported. Unexplained injuries or those requiring treatment must also be documented and reported per regulation. Behavioral incidents like aggression or self-harm that cause injury or property damage must be documented and may require licensing notification. Medication errors involving the wrong resident, dose, time, or missed medication must be reported. Any suspected physical, emotional, sexual, or financial abuse is a mandated report and must be reported immediately. An elopement, where an unauthorized resident leaves unsupervised, is reportable, especially if their safety is at risk. The Special Incident Report, or SIR, must be completed before the end of your shift and submitted following facility policy and licensing timelines. Failure to report or delayed reporting can lead to civil penalties. Infection control requires DSPs to wash hands properly, use PPE when required, clean and disinfect surfaces, handle soiled laundry safely, and follow illness protocols. This prevents outbreaks and citations. Hand washing must be done before and after resident contact to prevent disease transmission. Use PPE, such as gloves and masks, when there is exposure to bodily fluids or illness risk. Routinely clean and disinfect high-touch surfaces to maintain a safe environment. Contaminated linens must be handled and washed safely to prevent cross-contamination. Staff must report symptoms, isolate residents when necessary, and follow facility outbreak procedures. Failure to follow these standards may result in licensing deficiencies. Environmental compliance involves maintaining hazard-free walkways, a clean home, proper food storage, locked chemicals, and clear exits. Surveyors inspect the environment closely. Walkways must be clear of clutter, cords, or obstacles to prevent falls and ensure safe evacuation. The facility must be maintained in a clean and sanitary condition at all times. Proper food storage means keeping food at safe temperatures and protecting it from contamination. Cleaning supplies and hazardous substances must be locked and inaccessible to residents. Emergency exits must remain unobstructed and accessible at all times. Surveyors closely inspect environmental safety during unannounced visits, and violations can result in deficiencies. DSPs ensure meals match the posted menu. Special diets are followed, snacks are provided, food is labeled and dated, and fridge temperatures are monitored. Meals served must follow the posted weekly menu unless documented substitutions are made. Physician-ordered or care plan diets, such as diabetic or puree, must be strictly followed. Required daily snacks must be offered as outlined in regulations and documented if refused. Stored food must be properly labeled and dated to prevent spoilage. Refrigerators must maintain safe food temperatures and be routinely monitored to meet health standards. Licensing surveyors inspect food service areas, and violations may lead to deficiencies. Under HIPAA and Title 22, resident health and personal information must be protected. Limit access to authorized staff, secure records, avoid public discussion, and properly dispose of confidential documents. Never share resident information in public areas, with unauthorized persons, on social media, or with other residents. Protect records at all times. Professional conduct requires DSPs to use respectful language, avoid baby talk, maintain boundaries, greet visitors professionally, and follow the dress code. You represent the facility. Always communicate professionally and respectfully. Avoid baby talk. Residents must be treated as adults, and demeaning language may violate dignity standards. Maintain professional relationships, avoiding favoritism, exploitation, or inappropriate conduct. Greet all visitors, surveyors, and family members courteously. Staff must follow the dress code, maintaining appropriate appearance and hygiene. You represent the facility, and unprofessional conduct may result in corrective action. DSPs are mandated reporters. Immediately report physical, verbal, or sexual abuse, neglect, and financial exploitation. Failure to report is a legal violation. Abuse includes intentional force causing injury, threats, humiliation, non-consensual sexual contact, and failure to provide necessary care or supervision. Financial exploitation is the misuse of resident funds. Always be prepared for licensing visits, QA audits, and regional center reviews. Know fire drill procedures, emergency plans, resident diets, and behavior plans, as surveyors may ask questions. Non-compliance can result in staff discipline, retraining, suspension, or termination, and licensing citations for the facility. Compliance protects everyone. Daily compliance reminders include supervising residents, documenting care, following diets, administering medications correctly, reporting incidents, and maintaining cleanliness. A key question for reflection is whether your shift would pass a licensing visit if a surveyor walked in right now.